everybody. This presentation is about sexuality in the older adult, and it is a continuation of material that is covered in the reading of week 4 in fall of 2012. The World Health Organization defines sexuality as being a central aspect of being human, and it's something that transpires throughout life, and it encompasses many different components, including our sex, our gender, and the identities and roles that we fulfill in life. It includes our sexual orientation, our intimacy, and pleasure and reproduction. Sexuality is experienced and expressed in our thoughts, our actions, our desires. It's portrayed through values, beliefs, practices, and relationships. And sexual health is on the positive end of the sexual health continuum, and it's a state of well-being that's related to our ability to holistically manifest and live out our sexuality through our physical, emotional, and social aspects. On the other end of the sexuality, wellness, health, and continuum is, of course, sexual dysfunction, which results from the inability to successfully and satisfactorily express one's sexuality. We know that depression and despondency are often the result of sexual dysfunction, and we also know that substance abuse, whether it's alcohol or drugs or other chemicals, can also contribute to sexual dysfunction. So, you see here, your father and I aren't as wild as we used to be. Does arm wrestling for the last slice of pizza count as intimate physical contact? The concept of sexuality, our own perception of what sexuality means to us as individuals, certainly changes over time. But something that remains constant is that it's typically considered an important part of health, our general well-being, and quality of life. But how we define it does change. Again, it includes various types of various types of activity that is intimate. It includes our knowledge, our beliefs, our attitudes, and our values. The benefits of sexual expression for adults, it's a source of pleasure. It's pleasurable. It helps us maintain a sense of self-esteem. It allows us an avenue to express love, affection, loyalty, and it also can enhance our own personal growth and creativity and communication. And the joke here is that, when he hugs me, I still get chills up and down my spine if he's holding an ice cube. So what it takes for us to experience sexual expression and sexual satisfaction may change over time, but even as older adults, we certainly still can experience the pleasure of sexuality, of expressing ourselves sexually. Now, what are some of the barriers for sexual expression in the older adult? We know that physiologically there are changes in hormones that may result in a decreased libido and a decreased desire. There's certainly a decreased production of testosterone. Decreased vaginal secretions can make sexual intercourse painful, but what else about aging? Let's talk about some physical limitations that may arise from decreased muscle mass and strength. So the ability to perform certain types of sexual activities may be diminished because of that. We may have diminished energy, changes in our body image. What about the impact that changes in our urological system might have on our ability to engage in sexual expression? For example, what about the older adult who experiences stress or urge incontinence? That's certainly going to interfere with our ability to express ourselves sexually. Again, it doesn't mean that we can't do that, but it does indicate that we may need to, in fact, alter how we consider ourselves as sexual beings. Diseases certainly have an effect on our ability to sexually express ourselves. What about shortness of breath as a result from obstructive lung diseases? It's certainly going to be an impediment to the act of intercourse. Cardiac issues, osteoporosis. Some of those considerations certainly bear uh, certainly are important for us to think about when we're assessing and evaluating the older adult and assisting them to maintain a satisfying sexuality. We know medications can cause problems with erection. Medications can cause somnolence. Medications can have an effect on our sexual desires. Um, and then what about our societal beliefs? Most people don't think of older adults engaging in sexual activity on a normal basis. Sex and sexuality is for the young. Look at our media, how everything is portrayed for the young. Many people believe that sexual desires always disappear with age, that old people aren't interested in sex. Um, Individuals tend to interpret the concept of sexuality very, very rigidly and formally, that sexuality simply means the act of sex. And then what about the considerations of the lesbian, gay, bisexual, and transgender individuals and their the impact of those situations on sexual expression? Social circumstances change in the lives of the older adult. People who have been married for 50 years suddenly lose a spouse. Is it morally okay for them to consider an intimate relationship with someone else? Do they need permission? Do they need permission from their adult children? Do they need permission from a spiritual being? Or is it just something that they need to come to terms with themselves? Um, Older adults who no longer live together because one or the other needed to be placed in a long-term care facility. What about the ability for those two, that couple, to express themselves sexually? What happens to that? Do those needs and desires simply just go away because the person isn't living with them anymore? My guess is not. Um, as the population ages, we know that women are outliving men by 7 or so years on an average. So, what about the absence of male partners for the older adult females who are heterosexual in their sexual orientation? There just aren't as many older males around. So, these are some of the barriers that exist for sexual expression in the older adult. To compound these, if you think about the healthcare professional, many healthcare professionals uh, inter- fail to intervene or carry out interventions that actually facilitate older adults' expressions of sexuality. It's not something that we necessarily pay attention to or address. This next slide is a depiction of the results of a study that was done in 2007 with a study of 3,000 older adults. So not a huge sample, but 3,000 is, that's a reasonable sample for us to get some sense of reliability from the results. And these older adults were interviewed about their level of sexual activity. And you can see the orange line it represents individuals that were interviewed between ages 57 and 64, and they represent the highest level of sexual activity. At about 73% of them reported that they were still sexually active, and it starts to decrease as the sample population gets older. Those who fell in the middle age bracket of 65 to 74 report about 53% of those individuals reported that they were sexually active, and a surprising number, about 26% of the older adults aged 75 to 84 still considered themselves to be sexually active. Okay, so what is sexually active? What is sexual expression? We know that there are many, many forms of interpretation of this term. But let's talk about touch for a minute, okay? And we can see in this picture that, touch is a basic human need, that even as infants, we need to be touched. We need to be held. And, this is something that even as older adults, most older adults still have the need to be touched. How many of you can think of a couple of residents that you've seen in the long-term care setting so far this semester who you've seen embracing some of the nurses, or if you've gone up to them and you've held their hand, you're afraid you're never going to get your hand back because the older adult is thriving on that positive touch that you're providing for them at that particular time. We do, as nurses, need to recognize that many older adults in long-term care facilities are really reaching out and have the desire for nurturing and the positive effects of touch. But we can't just automatically assume that that's true for every older adult. And we must consider that some of our non-nursing task-related touching could be viewed offensively if that older adult is not being receptive to touch. So in addition to being a positive way of expressing caring and warmth and concern, touch can also be an invasion of space, and we need to respect our older adults' preferences for how to touch, where to touch, how not to touch, etc. Okay. So here, after all these years, I still tingle when you touch me. I'm not sure if it's love or poor circulation. So we still have feelings, and we can still get excited when a special person, someone we have an intimate relationship with, touches us in a certain way. So what about the question, sex among nursing home residents? Is this something that we as healthcare professionals have anything to say about or not? If you want to hear an interesting perspective, it's about a 4-minute video. Go ahead and copy this URL that you see on this slide into your browser, and an ethicist from New York talks about how we as healthcare providers could or maybe should consider the value of allowing and encouraging sex among nursing home residents. Do we need to consider the ability of individuals to competently make the decision to engage in some sort of sexual expression? Probably. Especially we need to protect those individuals who are vulnerable because of severe cognitive decline and confusion. But certainly, we should understand and recognize that there are circumstances and situations in the long-term care setting where we need to be sensitive to the need for two individuals, regardless of their sexual orientation, to have the privacy and the right to express themselves sexually. Okay, the healthy sexuality with our older adults is going to be contingent upon good communication between the nurse and the patient. And we need to be comfortable ourselves in conducting a sexuality assessment with our older adults. But we can't just go ahead and barge in there and start talking about private issues with older adults without consulting with them and getting their permission. If you go to the consultjerryrn.org website and you pull up the how to try this tool on sexual assessment, you'll find the acronym PLICIT is employed here. And it indicates that, yes, of course, we do need to initially obtain permission from the client to initiate sexual discussion. More and more of the older adults that are part of the baby boomer generation are going to be probably pretty comfortable talking about sex and sexuality. This is not the case with some of our centenarians that are currently centenarians. They grew up in a time period where sexuality was very, very private, and it was not appropriate to discuss it, even with your healthcare providers. So, considering the generation that you're addressing, we'll have some indication, but of course, as always, there are individual variations that need to be considered. So the PLICIT model, P stands for gaining permission, the LI stands for being able to provide information regarding the need to function sexually. The double S stands for providing specific suggestions, and the IT indicates the importance of providing intensive therapy surrounding the issues of sexuality for that particular patient. So get permission, provide limited information, provide specific suggestions, and make sure that the individuals get the necessary therapy that is required. So, a proactive approach to obtaining a sexual health history is important. It may not be so important in the acute care setting unless you're dealing with illnesses or medications or procedures that definitely have an effect on sexual performance. But if you're going to talk about a residential setting where you're going to be caring for someone on an ongoing basis and they're going to be living there, then we certainly cannot ignore the concept of sexuality and the need to be able to express oneself sexually. So again, the goal is to gather information that allows the patient or the resident or the client to express themselves safely and feel uninhibited by whatever's going on with them physiologically or emotionally. So how about this? Can you tell me, Mrs. Smith, how you express yourself sexually? Or what concerns or questions do you have about your sexual needs while you're here in the long-term care setting? I know that you and your husband are living in separate residences now, and what kinds of concerns do you have? Or in what ways has your sexual relationship with your partner changed as you have aged? And what interventions or information can I provide you with to help you fulfill your sexuality in a satisfactory manner? As in most situations, when you're doing any kind of assessment, you're going to want to provide a quiet, private meeting area. You going to want to attend to the immediate physiological needs of the resident or the patient. Make sure they've got their hearing aids and their glasses on, etc. And get at eye level with them, and go ahead and engage in seeking permission and exploring with the adult how you might help them. Make sure you refrain from using inappropriate terms. Try to stick to general terms and use the older adults' cues in terms of what types of terms they're comfortable and they're familiar with in terms of expressing their sexuality and their sexual needs. You want to go ahead and make sure you review medications and medical conditions with them and discuss how some of those may contribute to some sexual dysfunction. You want to make sure that you include an assessment of the breasts and other genitalia. That's essential if you're going to assist an older adult in maintaining some type of sexual health. And consider lab tests. They may be useful in determining, severe diminished levels of hormones that may contribute to a decreased libido or erectile dysfunction. Continue your sexual assessment by obtaining information from the older adult about their sexual preferences, their sexual orientation. Do they have a special person in their lives right now? Make sure you include a good cognitive assessment so that you can make sure that the individuals are competent to make decisions to participate or not in sexual relationships while they're under your care. Some of the nursing diagnoses that go along with older adults and sexuality are listed here. I'm not going to read them for you, but those just give you an indication of some of the common nursing. So once you've gotten the assessment information from your patient and you've had the opportunity to discuss with them what their overall goals are, making sure that there, of course, are realistic goals, you're going to want to make sure that you develop an individualized care plan for your patient. Make sure you're aware of the fact that there's a lot of information out there that can be provided for our patients who are older or who have physical disabilities. They don't have to be old. They could just have physical disabilities we can educate them on how they can still express themselves sexually and make the appropriate compensations. You want to make sure you educate the older adult that if they do engage in sexual intercourse, that they are at risk still for contracting sexually transmitted diseases and HIV, and maybe even more so than their younger counterpart because of a diminished immune system that's a normal part of aging. And with the female, the changes in the vaginal mucosa and the vaginal tissue make that more prone to developing fissures, which would be a direct source for contamination and spread of infection. So consider the family members of the older adults that you're working with. The family members may consider this interest and behavior of their loved one inappropriate. You may need to provide education there, and always make sure that you are maintaining a safe environment for your patient if they are going to be engaging in sexual activity. Outcomes include the client attains a satisfactory level of sexual activity. They are able to discuss their concerns with their significant other. They're able to talk about it. I have at the bottom here a URL that again you can put into your browser. It's the trailer for a movie that's out right now. The movie is called Hope Springs, and it has Meryl Streep, Tommy Lee Jones, and Steve Carell in it. And it's about an older couple, and Steve Carell plays the counselor, but the older couple, the female in particular, is not happy with her sex life anymore. They don't have one, and she engages her husband of many many years to come away with her and go for counseling to see if they can't improve their sex life. And I saw the movie. It's not great, but it certainly is very appropriate here and highlights how common it is for a couple to grow apart in their needs for sexual intimacy, and how over time we get into our routines and suddenly we wake up someday and we realize that we've lost a very what used to be a very important part of our lives together. So you don't have to look at it, certainly not testable material, but I thought it certainly provided further insight on this topic. Okay. This slide predominantly addresses how we as nurses should encourage low-risk sexual expression behaviors in our older adult population, just as we would a younger population. We want to make sure that we provide privacy when older adults need to have privacy to express themselves sexually. And as always, a focus on maintaining safety for our older adults is important. And I'm going to just skip to the last slide here. Just try to eliminate your stereotypes. Try to make sure that staff is educated about the importance of sexuality and intimacy throughout the lifespan. It's not just for the young kids. Our older adults are just as in need of intimacy and feeling loved and being loved as our younger counterparts. It just changes in how they express themselves and perhaps what their physical needs are. Make sure that we eliminate the stereotypes. Make sure we provide education to the family. And again, my main gist here is to treat the individuals with respect and treat them holistically and not as children. Please be sure you address any questions that you might have with me, and I'd be happy to answer them. This ends my presentation on sexuality and the older adult.